Hi everyone, my name is Anindita Khansa Batrisya and my partner is.
Evelyn Elvina Putri Wiratmo.
Today we will talk about something that not a lot of people talk about, and that is mental illnesses. In Indonesia, mental illness is still a taboo subject because either people don't want to talk about it or just not aware of this.
This is a serious problem because mental illness could lead to many unwanted things, such as bullying, self-harm, and suicide. So, what is mental illness? Mental illness is a behavioral or mental pattern that causes significant distress or psychological impairment of personal functioning. They are generally characterized by some combination of abnormal thoughts, emotions, behavior, and relationships with others. Examples are schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse.
What caused this to happen? Mental illnesses may be caused by a reaction to environmental stress, genetic factors, biochemical imbalance, or a combination of these. With proper care and treatment, many individuals learn to cope or recover from a mental illness. Certain factors may increase your risk of developing mental illnesses, including stressful life conditions, ongoing medications, traumatic experiences, usage of alcohol or recreational drugs, a childhood history of abuse or neglect, a previous mental illnesses.
What are the types? There are many types of mental illnesses, and they are 1. Anxiety disorder. An anxiety disorder is diagnosed if the person's response is not appropriate for the situation. If the person cannot control the response, or if the anxiety interferes with normal functioning. Anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Next, mood disorder. These disorders, also called affective disorders, involve persistent feelings of sadness or periods of feeling overly happy or fluctuations from extreme happiness to extreme sadness. Next, psychotic disorder. Psychotic disorders involve distorted awareness and thinking. Two of the most common symptoms of psychotic disorders are hallucinations and delusions.
There are also eating disorders. Eating disorders involves extreme emotions, attitudes, and behaviors involving weight and food. An example of eating disorder is anorexia. Personality disorder. People with personality disorders have extreme and inflexible personality traits that are distressing to the person and or causing problems at work, school, or social relationships. There's also obsessive compulsive disorder, or in other words, OCD. People with OCD are plagued with constant thoughts or fears that cause them to perform certain rituals or routines. And these are just a few of the mental illnesses that we need to be more aware of.
Well, it's important because the more we are aware and the more we are informed about the types of mental illnesses, the more we know how to deal with them and how to control them. Because sure, people are aware of these illnesses, but they don't know how to handle them or just simply don't care. Which is why learning about these mental illnesses are very important because the more we learn them, the more we can help.
Problems caused by mental illnesses. When left untreated, it can worsen someone's health mentally and physically. It could hinder a person from doing their daily necessities. For example, a person with an eating disorder could struggle getting their nutrition because they're either eating too little or too much of something. A person with an OCD could struggle with smallest thing like locking the door. The person will lock and unlock the door so many times just to make sure that the door is locked. What are the symptoms? Well, symptoms are feeling sad or down, confused thinking or reduced ability to concentrate, extreme mood changes from high and lows, withdrawal from friends and activities.
Detachment from reality or delusions, paranoia or hallucinations, excessive anger, hostility or violence, and suicidal thinking. What to do? Well, there are many solutions for people with mental illnesses. First, they could speak up to their family or their friends. Second, you can go to a doctor to get help. And you can also go to a support group with other people with mental illnesses. Or, in case of any accidents, try call Layanan Gawat Darurat Indonesia. This is the number. So, if you witness someone with those symptoms, try to talk to them or get them to consult with someone because mental illnesses are not something that we can see from the outside. That's it for our presentation today. We hope that you will find this helpful and see you when we see you. Bye bye.